Okay, I think I'm recording, and I think I can only do this in 10-minute increments if I remember correctly. So we'll go through this, and I'm going to do this a little differently than I've done in the past. I'm using a PowerPoint from another textbook. It's the textbook that I use at Harvard Community College. I like the textbook a little better. I like the PowerPoints a little better. And so it doesn't quite match up word for word with what our textbook says, but it's the same exact information in the same exact chapter. It goes in a slightly different order. So in chapter 21, we're talking about blood vessels and blood circulation. And we're doing this, just a brief introduction on blood vessels. Blood vessels are classified by their size, by their tissue organization, and obviously we need them for the overall function of our cardiovascular system and the regulation of it. So you can make a classification system of our blood vessels. There's arteries. Arteries carry the just making sure I'm still here. Arteries carry the blood away from the heart, arteries away, right? There's arterioles, that's the next smallest branch. Arteries branch off into arterioles, and then arterioles branch off into capillaries. So those are the smallest blood vessels, and those are the ones where there's actual exchange taking place, nutrients, gases, etc., waste products. The venules are then collecting from the capillaries, and then the veins return everything to the heart. So the largest blood vessels, again, are the ones that attach closest to the heart. So the closer to the heart you are, the larger those vessels are going to be, and the further away from the heart you are, the smaller the vessels are going to be. We have the pulmonary trunk and the aorta. Those are the vessels that attach directly to the heart. The arteries, really, they're carrying blood from the right ventricle directly into the pulmonary circulation, and then the aorta is carrying that blood from the left ventricle all the way out into the systemic circulation, wherever that destination may be. The smallest blood vessels are the capillaries, where the gas exchange takes place. They have a very small diameter, very thin walls, and that's going to allow for the gas and chemicals to diffuse across. The overall structure of vessels, you're going to see this structure revisited in future chapters. There's an inner layer, a middle layer, and an outer layer. Tunica intima is the inner layer, tunica media is the middle layer, and tunica externa is the outer skin, if you will, of a blood vessel. So you can see here the differences between the different layers and the differences between an artery and a vein. If you just look at this cross section here, you can see the lumen of an artery is very much round. It's defined, and that's because the arteries are where the higher blood pressure is. In the lumen of the vein, it's more lackadaisical, it's laid back, it's even shrunken in some places because the blood pressure within the veins is very, very low. The tunica externa is roughly the same on both veins and arteries. Where it's different really is that tunica media. The tunica media is much thicker on the arteries than it is on the veins, and that's because our arteries have the ability to expand and contract based upon sympathetic and parasympathetic input, whether the arteries are going to dilate or they're going to constrict in different parts of the body based on the stimuli. And then you have the tunica intima, roughly the same between arteries and veins. It's a little bumpier, I guess you would say, has an increased surface area on an artery. That way it can expand a little bit more. Again, that tunica intima, that innermost layer, has an endothelial lining, just like all linings, and that layer of connective tissue, and that elastic layer that is mostly made of elastic fibers to connect it to the tunica media. And the tunica media is where the muscle is, media, muscle, right? Put those words together. And of course, it's smooth muscle we're talking about here within the cardiovascular system. It's going to bind both the externa and intima layers together, and it's just a separate membrane providing a barrier between the two. The tunica externa is going to anchor that vessel into surrounding tissues, into surrounding adipose or wherever it may be, with elastic fibers. The veins have smooth muscle cells that they are generally attached to. And there's also something called a vasa vasorum. Those are actually the vessels that supply the vessels. Just like our heart has coronary arteries, well, our vessels have to have vessels going to them so that the actual cells of the blood vessel themselves can get blood supply. So that's called a vasa vasorum. They're just very, very small arteries and small veins, and they're associated with the larger arteries and larger veins of our body. In general, arteries and veins run side by side. They're typically parallel in the body. Arteries have thicker walls, higher blood pressure. A collapsed artery just has that nice round lumen, as I mentioned, whereas a vein can have a flatter lumen. That arterial lining does not contract, and the artery lining has folds in it to allow for expansion. They're much more elastic, and veins have valves in them, one-way valves. You can see here some of the basic differences. Again, close to the heart, we have our large veins and what we call the elastic arteries. We move further away from the heart. Elastic arteries branch into muscular arteries. Muscular arteries branch into arterioles. Arterioles branch into capillaries. Capillaries can be continuous or fenestrated. We'll talk about the different types of capillaries in a bit. Those capillaries collect into venules and then medium-sized veins and then the large veins, which dump back into the heart. Notice how the tunica externa, media, and intima change as we go through the circulatory system, moving further and further away. In fact, look here at these arterioles. There is no tunica externa. There's also no tunica externa or tunica media associated with the capillaries. And there's practically no tunica media within the venules either. And that's just because structure is always going to be related to function. It has to do with what those things do, and their structure is going to help with that. Arteries are very elastic, as I said. They have a contractility associated with them to allow them to change in diameter. As I mentioned, they're controlled by the sympathetic nervous system. You have constriction going on, which is going to allow those arteries to get smaller, that lumen to get smaller, and then vasodilation, which occurs, which allows that smooth muscle to relax, enlarges the lumen, and increases blood flow. So overall, vasoconstriction and vasodilation have an effect on what's called the afterload of the heart. They also have an effect on the peripheral blood pressure as well as capillary flow. If those arteries are nice and big and dilated, that's going to decrease the afterload on the heart. That's going to decrease peripheral blood pressure, and that's going to increase capillary blood flow. And vice versa. If the veins or the arteries rather are constricted and much smaller, that's going to increase the afterload of the heart, increase peripheral blood pressure, and decrease capillary blood flow. So again, arteries moving from the heart, you have elastic to muscular to arterioles. Those elastic arteries are also known as the conducting arteries. These are the large pulmonary trunk and aorta. That tunica media has many elastic fibers, very few muscle cells, because there's an elasticity that's related to that force of contraction. So those arteries really aren't going to be collapsing or relaxing. They're not under sympathetic control. The muscular arteries are the distribution arteries. They're medium size. These are the majority of the arteries in our body. And that tunica media has many, many muscle cells, and it is strongly under sympathetic control, as are the arterioles. Arterioles are very small, little to almost no tunica externa, as I mentioned before, and a very thin or incomplete tunica media. And then the arterial diameter is going to change, again, with sympathetic as well as endocrine stimulation. There are different hormones that have a role to play here, and that those constricted arteries are going to oppose blood flow or increase what we call resistance. So resistance vessels are mostly those arterioles. They're very, very small in diameter, and those smaller muscular arteries are going to lead directly to those arterioles, increasing resistance as we get closer to the capillaries. An aneurysm is simply a bulge in the arterial wall. This could be from a weak spot in the elastic fibers, and that pressure builds and may actually rupture the vessel. The capillaries are the smallest vessels with very, very thin walls. Overall function is for exchange between the blood and the interstitial fluid. We'll stop here for video 1, assuming I can stop this. There we go.